Did you know that there is a strange disease out there that melts your brain? It's not a scene from a horror movie, but a terrifying reality. The disease is called KURU, and luckily it's very rare. However, it's still good to be aware of this disease and its symptoms in case you ever encounter it. So let's learn about it. KURU is a rare disease that affects the brain, causes the normal proteins in the brain to misfold, which leads to brain damage. These misfolded proteins then trigger normal proteins to become abnormal, leading to a chain reaction that damages more and more of the brain over time. This means that the time from infection to the onset of symptoms can vary greatly, which is a lack of muscle control or coordination. This can cause problems with balance, and you will experience uncontrollable shaking throughout your body. KURU is a very rare disease, and there have only been a few cases reported outside of Papua New Guinea. The reason it's so rare is because the infectious agent is very fragile and is easily destroyed by heat, sunlight, and normal cooking methods. Additionally, blood screening and donor testing have helped to prevent the transmission of KURU. Overall, the risk of contracting KURU is extremely low. But if you do travel to areas where the disease is more common, such as Papua New Guinea, you should take precautions such as avoiding contact with contaminated meat or body fluids of the infected. Other early symptoms include insomnia, anxiety, and depression. As the disease progresses, dementia and other neurological problems develop. This can include hallucinations, delusions, and paranoia. Eventually, the person will become bedridden and unable to eat or drink. Death usually occurs within a few months of the onset of these symptoms. Some people may show symptoms sooner, while others may not show symptoms for many years after being infected. The word KURU comes from the local language of Papua New Guinea, which means shaking or trembling. It is also in this place where the disease was first identified in the 1950s. Some tribes in Papua New Guinea used to practice ritualistic cannibalism, where people would gather and consume the body of a diseased loved ones. This is because of the belief that by doing so, they are helping the spirit of the disease to reach the land of the dead. The ritualistic consumption of the dead played a role in the spread of KURU. The prion protein which caused the disease was concentrated in the brain, making women and children who consumed more brain tissue more susceptible. Different parts of the body were typically given to different family members. Women and children were more likely to receive and consume the brain and spinal cord, which contain the highest concentration of prions. Men, especially warriors, were less likely to participate in these rituals and often consumed other parts of the body, such as muscle tissue, which were considered less infectious. Back then, KURU was not a well-known disease, and treatment is mainly supportive. There are no medications that can cure the disease. Treatment is focused on relieving the symptoms and making the patient comfortable. It was initially thought to be a new variant of Creutzfeldt-Jakob disease, a rare and always fatal brain disorder. However, further studies revealed that KURU is actually caused by a different infectious agent than CJD. KURU is caused by a misfolded form of a protein called prion protein. The exact cause of the misfolding is unknown, but it is thought to be related to both genetic and environmental factors. The first is through the consumption of contaminated meat, such as the brain or spinal cord of an infected animal or human. This is the most common way that KURU is transmitted. The second is through blood transfusions or organ transplants from an infected person. The third is through the use of contaminated medical equipment. And the fourth is through genetic inheritance. This is the least common way that KURU is transmitted. The disease was first identified in the 4 people of Papua New Guinea, who practiced the ritual of consuming the brains of deceased relatives. This practice is known as endocannibalism. While this custom has since been abandoned, it is still prevalent in some parts of the world. And this is one of the ways that KURU can be transmitted. The incubation period for KURU is thought to range from 6 to 40 years, with an average of about 12 years. Early symptoms of KURU include ataxia, muscle spasm, and uncontrollable laughter. That's why KURU is also called the laughing sickness. During your final days of being infected with KURU, you will experience difficulty controlling your movements. Even the simple act of speaking would be difficult. You would jolt with multiple spasms from different parts of your body, and you would feel the urge to laugh despite all the pain you're experiencing. And soon after, you're just gone. There is no cure for KURU. Now that you know how scary this disease is, do not allow yourself to get infected by KURU. I hope you learned something from this video. Please don't forget to hit the like and subscribe button to help this channel out. Stay safe out there, and thanks for stopping by.